Good afternoon, everyone. Thank you for joining the April General Thoracic Surgery Database webinar. First and foremost, we want to thank you for joining today's call. We hope you and your coworkers, friends, family, and loved ones are all staying safe and healthy during this time. Thank you for all that you do. On the call today, we have from the STS, we have myself, Leanne Jones. I am the database manager for general thoracic and congenital databases. And we also have Carol Crone, the senior clinical manager for the STS National Databases. We also have Donna McDonald, Director of Quality, as well as Jane Hahn, the Associate Director of Quality. Please hold all of your Q&A. Just wanted to, just a friendly reminder to please hold your Q&A towards the end of the webinar. We have an information-filled webinar, so a lot of your questions may get answered throughout this presentation. So again, please hold your questions until the end. I'm going to quickly run through the agenda for today's call. We've already touched on the welcome and introductions. I'll cover a few housekeeping items. Next, I'll run through some important dates for the thoracic database. We will cover the COVID-19 update, the public reporting and audit update, and we will end with your questions. Again, just a friendly reminder to please use the Q&A function to submit your questions. Please do not use the chat box for those questions. For our housekeeping items, just quickly, the April training manual has been updated and is posted for your review. Updated 241 data collection forms have been posted to the website for your use. These updated forms, as well as the training manual, include the new COVID-19 variable. I'll touch more on the new COVID variable here in just a minute. In regards to AQO, the status of AQO is currently being evaluated. Due to the current times, STS, we are evaluating AQO based on the COVID-19 pandemic that we're all going through, as well as we are aware there's a possibility that STS may not be able to hold AQO in Rhode Island as planned. Options for virtual meetings are being discussed and considered, and more information about AQO will be coming out soon, so stay tuned for more information about AQO. The STS and General Thoracic Surgery Database Task Force are currently working on the 5.21 data version upgrade. The STS and task force members have been holding weekly calls to work through the upgrade. In addition to these calls, STS staff has presented the DCF changes to the core group for comments and suggestions. We're going to be taking these comments and suggestions back to the task force for further discussion. Once we've done that, the next steps for the upgrade will include incorporating any additional changes and getting the data collection form ready for beta testing by our core group. Hopefully, we hope to have that beta tested next month. At this time, we are still on track to have the data specs to vendors in July with a go-live date of January 1, 2021. Some important dates for general thoracic. As you're aware, we have the fall 2020 general thoracic harvest is currently underway as of March 7. Today we have our April monthly webinar. Our next monthly webinar for May is scheduled for the 13th at 1:30 Central Time. The fall 2020 harvest is set to close on September the 18th. And of course, as I just mentioned, the 5.21 data version is scheduled to go live January 1st, 2021. Next, we're going to have a couple of polling questions for you in regards to how has your role been affected related to COVID-19, what types of procedures is your hospital performing, and where are the hospitals located that you're abstracting for mostly located. Hold just a second, let me get these. And you should be able to see those questions. There are 3 questions, so if you could answer those.
Yeah, I can see them over here, Leanne. This is Carol.
Okay, thank you. So if you could please vote.
Did you hit launch polling?
I did. Are they not working?
There it goes. Okay.
Oh, there we go. There we go.
Yeah.
All right, thank you. I can see the votes coming in now. And we'll just give everyone an opportunity to get their votes in. Looks like people are still voting. Thank you, everyone. Still seeing some results come in, so I'm just going to hold on just a few more seconds to get additional results in. All right, looks like our results are starting to slow down. So we're going to end polling. And we're going to share the results here. So it looks like for our first question, how has your role been affected related to COVID? Most of everyone, about 50% says no, there has been no change to our current role, with our next highest result being yes, my extraction role has decreased without any other duties. For our second question, what types of procedures is your hospital performing? 87% of you are only performing urgent and emergent cases only, which I think was not unexpected there. And then for where are the hospitals that you're extracting from mostly located? It looks like most everyone is in the Northeast US at this time. Thank you for participating in that, and that will help give us STS some valuable information and help us make decisions based on the COVID response, STS COVID response moving forward. So we greatly appreciate that. All right. So as you're aware, STS has added a new field in order to collect data on COVID-19. STS has activated the use of the temporary coded field, which is sequence number 4080. Per the data specifications, the temp fields should not be used unless expressly instructed to do so by the STS. So this sequence number 4080 is now being used to answer the question, did the patient have a laboratory confirmed diagnosis of COVID-19? In the past, we have found that some participants have been using this temp field for internal purposes. Again, please note that you should not be using these temp fields for your own use, specifically for this reason in case STS does make use of this temporary field. Because that we have found that some participants have used this field in the past, STS has chosen to use the harvest codes 10 through 15 for these choices. Like I said, in the past, we chose not to use 1 or 2. As you know, most of you are aware, a harvest code of 1 usually indicates a yes, a harvest code of 2 usually indicates a no. But due to the possibility of people actually having data already in those fields, we have chosen to implement harvest codes 10 through 14. Until the vendors are able to get these choices, such as no, yes, prior to hospitalization for the surgery, et cetera, added to your software, we suggest that you enter the actual harvest code for the response. So, for example, if the answer is yes in hospital prior to surgery. So until your vendor can actually get those actual choices added, we would want you to enter the harvest code 12. So you would just enter 12 for yes in hospital prior to surgery. And by doing this, this will allow you to go ahead and start entering this data, and this will allow your vendor to map those responses once they are able to get your software updated. So abstracting the COVID-19 fields. Why was this field added? Obviously sites have reported that patients who are found to be COVID-19 positive are having worse surgical outcomes. We've already getting asked, do we really need to go back to January to abstract this field? No, you do not have to go back to January 1, but you can go back to January 1 if your site was impacted early on. Will the patients be included in the outcomes? STS is currently in discussion. Our surgeon leaders are in discussion regarding how these cases will be handled. Once we get the data in, we will need to get the data, take a look at it, and see its impact before we can make a decision. Another important question that we've gotten so far is, can I abstract a patient who is assumed to be COVID-19 positive but was not tested? The answer to that is no. You should only code yes for a patient who has been confirmed to have COVID-19 through laboratory testing. In response to a question regarding COVID-19 after discharge, surgeon leaders have indicated for patients that self-report testing positive for COVID-19 within 30 days of surgery, you should indicate yes after discharge within 30 days of surgery. As most of you are aware, per the STS notification on March 31st, STS public reporting for general thoracic and adult cardiac surgery have been postponed for 2020. The next public reporting refresh will be in January 2021. Sites will still receive star ratings for your spring 2020 analysis in your reports, but again, these results will not be used for public reporting for 2020. As stated earlier, we are still on task for data version 5.21 go live as of January 2021. Obviously, STS is monitoring site needs, and we will respond accordingly as we get closer to that date and as we move through the data spec upgrade process. In terms of the general thoracic audit for 2019, for the 2019 audit, which covered 2018 data, CRS completed 29 site audits. All of those 29 sites have received their data summary reports from CRS and STS. So those data summary reports have been provided to all of the audited sites. For the 2020 audit, which would cover 2019 data, STS surgeon leadership is evaluating the 2020 audit. Communication will be sent out as soon as possible with next steps. We do have a poll that I would like to launch next in regards to your audit experience. So if you could please take a moment to answer the following audit polling questions. And of course, the question is, what is the time resources need to perform the GTSD audit at your hospital?
I am not seeing this one yet, Leanne. I'll launch
Okay.
it and see if I can launch it here.
It says it's in progress and it's viewing, but I don't know if there's maybe a lag. I'm not sure. I'm not seeing any results come. No.
I'm not seeing it either. Okay, hold on one second. Let's see if we can.
Sorry, everyone. Thank you for your patience.
Can you try to reopen it? What's on your screen right now? Sorry about this, everybody.
No, it's okay. Let's see here. Relaunch. Continue. All right. Okay, perfect. All right. So again, I apologize everyone for the little technical difficulty there, but again, the audit question, what is the time resources needed to perform the STS general thoracic audit at your hospital? All right. We still have results coming in, so thank you, everyone. We'll just hold on just a couple more seconds as more of these responses come in. All right. And just a few more seconds. We still have a few more responses come in. Okay. Thank you, everyone. So based on the results, it looks like 34% of you have indicated it takes a significant time, a moderate drain on resources, followed with it is extremely time consuming and extreme drain on resources. And then 28% of you have not been audited. So thank you for taking part of that. And again, that will be used, these results will be used and provided to surgeon leadership while they are evaluating the 2020 audit. All right. If you have any questions, please do not hesitate to reach out to me directly. Here's my email and my direct phone. If you have any STS operational questions regarding your contracts, contact information, usernames, passwords, please email stsdb@sts.org. Again, if you have any questions regarding anything, you can always feel free to reach out to me directly. If I'm not the person that can answer your question, I will definitely get you to the right person, or we will get you an answer immediately and get back to you. Thank you so much. So next, we are actually going to turn things over to you for Q&A. Just a friendly reminder to please submit your questions using the Q&A function on the webinar and not the chat box. Looks like we also have some questions coming in already, so we will get to our first question. Do we enter 10 if no testing for COVID completed? And no, hold on, I'm going to get the COVID slides back up, so hold just 1 second. Okay. Again, the question was, do we enter 10 if no testing for COVID is completed? And no, the question is, sorry, did the patient have a laboratory confirmed diagnosis of COVID-19? So you just simply answer the question, did the patient have a laboratory confirmed diagnosis of COVID-19? It's not asking if the patient was tested, yes or no. We're just asking, did the patient have a laboratory confirmed diagnosis?
Yes, and this is Carol. I'm just going to add in here for that question. So patients who are not tested, and for patients who are tested but test negative, you would code Harvest code 10 as no. So the question is, did the patient have a laboratory confirmed diagnosis? So you have to meet two requirements, that the patient was tested and that the patient was tested and that their results were positive. If they were not tested, or if they were tested and their results were negative, you would code no.
Perfect. Thank you, Carol.
You're welcome.
All right. Let's see. Our next question, would you show the previous slide with the COVID details? And Tony, these slides will also be, these slides will also be available on the STS website as well. Here is, of course, this slide with the field added for COVID-19. And also here is the slide for abstracting the COVID-19 fields. Again, this information will be, this presentation and these slides will be PDF'd and available on the STS website, hopefully by the end of this week. Our next question is, what is the root cause as to not public report in 2020? I don't know if Donna, if you want to take that one, or you might be on mute.
This is Jane. I can take this one, Leanne.
Oh, Jane. Okay. Thank you, Jane. Sorry.
Sure, not a problem. Thank you for your question. So a few weeks ago, STS leadership reviewed all of the Society's initiatives, including those in the database area. As you can see, Leanne gave some updates regarding possible changes to AQO, and the Harvest deadlines were reviewed as well. One of the things to help alleviate, in addition to those changes, one of the items that we'd hope to alleviate the burden on participants as we all adjust to this new normal caused by the coronavirus is to also postpone public reporting. So the root cause was our response as an organization to help with our database community and all of the data managers who work so hard to submit data and to manage public reporting. We thought that our leadership thought that would be an element that we can postpone until January 2021 until we have a bit more of an understanding how the year will progress and continue. Hope that answers your question.
Thank you, Jane. Any chance you can show the poll results from the first 3 polls? Good information for us to pass along. Carol, do we provide the slide, do we provide the poll results online as well with the presentation, or is it, I'm sorry, I'm not clear if that's been done in the past with adult cardiac.
I was answering you, but I was on mute. Sorry. We can post them as a PDF. Sorry about that. We can post them as a PDF, but we can also reshare them here if they don't want to wait for that. So I'm just going to reshare them again. And I think all three of them show up on the screen. Oh. So that's the, and I'll leave them up. You can go on, Leanna, and I'll just change these in a second to the other poll if you'd like.
Okay, perfect. Would it be possible to share results of audits and common mismatches found during the audit process? This would be a great educational tool to improving consistency across participants. I don't know, has STS done that in the past, Carol? I'm not sure.
Sure.
I apologize, I'm still new to the audit process on the STS side, so I apologize.
Yeah, no problem. So usually we share these results at the annual meeting, and I think, or not, I'm sorry, not at the annual meeting, at the AQO, we typically do audit sessions for each of the databases and go through the common mismatches, and we use the audit to kind of guide the educational sessions for AQO. I think that now that we've started webinars, we'll also be able to go over the audit, some common findings in the audit where we had a lot of mismatches or discrepancies. We'll be able to do that on these webinars as well. So when we get, I think we just finalized the results for the 2019 audit, and I think Emily Conrad is sending out those results. If sites haven't all received them that have been audited, they should be out shortly, and she's completing the aggregate. So once we have all of that and we run it by the task force and we answer their questions, then we would be able to share it out more publicly with the common, with our aggregate results, our aggregate findings and common areas that we need to focus on. So we can probably plan that. This is April, so probably maybe June or July, depending on what's going on then, probably June or July will be when we'll be able to do that.
Great, thank you, Carol. Our next question regarding COVID, response 11, 12, 13 require a test result. But after discharge within 30 days of surgery, patient statement of results is sufficient. Is this correct?
Are we reading, am I reading this one from Nancy?
Yes, from Nancy.
Okay. So yes, so we just clarified with the surgeons on this question, and we'll provide clarity in the training manual for May. For patients who are discharged home and then you call to do their follow-up within 30 days of surgery, and they say that they have tested positive, then that's sufficient to code yes for that patient. So you just have to make sure that the patient does say that they were tested, and the test for that COVID-19, not just any COVID, not just the regular, not any type of COVID, but specifically COVID-19, and that result was yes, that's sufficient to code it as yes.
Great, thank you, Carol. And like Carol had indicated, we'll get that information added to the training manual. All right, our next question, will the public reporting in 2020 remain the 2018 data? I'm sorry, Jane, I don't
No worries,
I'll
take all not a problem, I can take all the public reporting questions. What it currently is posted on the website, which is data through December 2018, will remain on the website. If you wish to rescind, or if you're interested in taking those results down, we're happy to accommodate that. So if that is the reason for this question, please go ahead and submit or send an email either over to Sydney Clinton, SCLINTON@sts.org, who manages public reporting, or you can send an email to the STS database inbox and I'll forward that to Sydney directly.
Thank you, Jane.
I'll put those email addresses into the chat box.
Oh, thank you, Carol. Our next question, what is data version 5.21? Is that the training manual of the DCF? So right now, the thoracic data version is collected under data version 2.41. The databases go through a version upgrade every 3 years, and this is the year for the general thoracic database upgrade. So our next data version is going to be data version 5.21. So the data specs and the DCF for this new version will be referenced as data version 5.21. Our next question, will thoracic be used for U.S. News and World Report similar to how congenital and adult receive points? I'm not sure.
I can take that one as
okay,
well.
Perfect. Go ahead, Jane.
Sure, Leanne. So the U.S. News Initiative and how they use the results that we post on the website, that's independent of STS. It's not an STS initiative, so we're unable to comment on how U.S. News intends to use the data that's there. Unfortunately, sorry, we couldn't be more helpful, but that's not an STS initiative.
Thank you, Jane. Our next question, our surgeons receive their MIPS report. What should they do with them? I assume, Nancy, I think this is in regards to adult cardiac, thoracic, we don't.
There are both. This is Donna. They don't need to do anything with them. That's just for their information. We'll be submitting on the part of any surgeon who consented, who had significant or enough data to submit to MIPS.
All right. I don't see any other questions. So if you have any questions, please get those submitted so we can get those answered for you. Carol, do you have anything you would like to add about anything or anything that I may have missed?
No, I think you did a great job covering everything, Leanne. I see another question that just came in, and we can stay on, and see if we get more questions in regarding any collection of the COVID field or any questions regarding. We also have IQVIA on the line. They're on the panelist side with us. So if there's questions for IQVIA, we can certainly farm them over to our IQVIA partner. And but I think you're doing great. I think this was great.
Okay. We did get another question and said, Jane, and I think this would be directed to you for public reporting. Will there be an explanation on your public reporting site to explain the lag in data being 2018?
Thanks, Leanne. Yes, there actually is an announcement that was already posted on both the STS website's public reporting page and then the public reporting main site as well. So it's consistent with the messaging that was sent to database participants and which are posted also on the STS website. So we're trying to be as transparent as possible and communicate this out to the public. So if you were to visit the public reporting website, you should see the announcement there.
Great, thank you, Jane. Again, if you have any questions, please feel free to get them in. Here we have another, we do have another question that just came in. It says, do we have a timeline from IQVIA as to when the thoracic dashboard will have more robust features like the cardiac site?
This is Jeanette.
Go ahead.
From IQVIA. So the thoracic dashboard was updated to have a number of additional items and was based in some ways with similarities to the adult dashboard. If you have specific features that you'd be interested in seeing on that dashboard, which is going to be undergoing some improvements, then could you please reach out to the IQVIA support team and share that feedback, and we'll look at ensuring that that's part of our plan for future updates.
Great, thank you, Jeanette. Looks like we have a few more IQVIA questions coming in. So our next question is, I had several records excluded from the most recent data harvest due to bugs. As of Friday, from IQVIA, or due to bugs that IQVIA cannot fix in time, as of Friday, they still cannot give me a time frame for the issue. Will I be allowed to resubmit that 2019 data once IQVIA has fixed the problem? I'm sorry, Mary, I don't know, Jeanette, if you wanted to address this, or Mary, if you've submitted a ticket to IQVIA to follow up with support. or if you could provide your ticket number to me directly, and then I could work with IQVIA to get a response to you, and we could look into that issue that you're having. Our next question is, I don't have a question, but would rather share my feelings on an audit. I feel doing it remotely, as most of us are working, will be difficult, as there is staff we need to speak with, medical records, etc. Thank you, Joy, for your comments. We will definitely share that with the auditors, as well as STS leadership that are handling the audit. So we appreciate your comment.
Hey, Leanne, this is Paul.
Hi, Paul.
Hey, I just wanted to go back to the previous question where they were asking if they could resubmit their data. The answer to that part of the question was yes. That you know, you can always submit data going back farther. So I'm not sure which issue you were talking about, so I don't have a timeline for you know, any corrections. But the system is set up for you to be able to resubmit your data, so you will always be able to do that.
Thank you, Paul. Our next question, someone's having a question regarding the missing report. We're showing items which are not required for non-analyzed cases. What is the status of getting this resolved? And this is, Jeanette, this is in reference to STS 2619. So I don't know if you all had an update on 2619.
So that's something that we are still working on. If you've reviewed your data and are confident that what you have in the file is what you were expecting, we are looking at adjusting the missing variable report to show sort of different feedback depending on that designation within each record. So, and if that is related to the comment that was earlier about the defect, if you're seeing a discrepancy within the missing variable report, but you feel that any of the fields that were submitted were what you would expect, then your data is available within the system and would be included in the harvest as it was submitted. We are continuing to work on and follow up on the missing variable report adjustments. And when we do have those updates posted, we will post a notification in the system with those changes, and then we'll also likely announce it in any user group meetings that are happening shortly before or around that time.
All right, thank you, Jeanette. And yes, hi, Melanie.
It's Melanie, hey. I just wanted to also give feedback on the STS 2619 that was posted. I saw someone had posted that, and we do have some recent comments on findings that was added today. So I think based on what I'm seeing, we will have that support representative contact you back. And I think we have individuals listed here. So the support person that you were working with in regards to that specific item should be reaching back out to you in regards to feedback on the missing variable report. So just wanted to share that.
Right. Great. Thank you, Melanie. Mary, I see your ticket number, so thank you. We will share that with the IQVIA staff has that. So as Melanie said, someone will be following up in regards to that specific ticket number. And Carol, the survey results did not appear. Can we try to show it again? I can try and.
Oh,
or do you want to try and show?
Yeah, I'm sharing it now. And just if people aren't seeing it on their screen, you might see a button in a black bar somewhere, or where you see the Q&A to submit the Q&A. There should be something that shows up when we're sharing results that says polls. So if you click on that, they should show up on your screen. When we stop sharing, that polling button will go away. Thanks, Leanne.
Right. No, thank you, Carol. Our next question, I missed the first part of your presentation. Will the spring thoracic harvest reports be posted per the published schedule date, or has the publishing of national reports been postponed? Thank you for your question, Claudette. We are still working to get the results posted. I think they're scheduled to be posted by the end of May. Obviously, with everything that's going on, STS staff is and leadership is working and aware of everything that sites and participants and we're all having to deal with during this crazy time that we're all in. So if there are any changes or the date for the release has to be pushed back, STS will be in communication with sites, with participants as soon as possible to let you know if there are any changes that are anticipated in that posting, results posting, currently scheduled for the end of May. So again, we will be in touch and let you know if there are any delays and information regarding that end of May date. I don't have any other questions at this time. Again, if you have any questions, please feel free. We have another question regarding the analyzed and non-analyzed filters. I think this is Mary. I'm not sure. If you could, I don't know if you've submitted a ticket to IQVIA. If you could submit a ticket and get support to assist with the filter issue that you're having, they would be able to get in touch with you and discuss those issues that you're having with the filter. Let's see, we've got about 8 minutes after the hour. Okay, thank you, Mary. Mary, do you have your specific ticket number that you had submitted, and we can, as Melanie said, we could get someone from support to follow up with you directly? That would be great. You can either just email it to me, and then I can forward on to Melanie and team if you'd like. Our next question, why are decortications an analyzed procedure but listed on DCF as minor procedure? Hi, Rachel. Thank you for your question. If you could submit that to IQVIA as get a ticket number so they could look into that specific issue, that would be helpful. That would be great, and that way we could look into see why it's that you're seeing that specific decort listed as an analyzed procedure, but it's listed as a minor procedure on the DCF, so that would be helpful. All right, we have about almost 10 minutes after the hour. We'll give another minute for any questions that may pop in. I'm not seeing anything at this time. Thank you, everyone, for calling in today. I know it's a crazy time for everyone, so we appreciate you taking time out of your day to join us for our monthly webinar. Again, if you have any colleagues that were unable to attend, this this presentation and the slide sets will be posted on the STS website for everyone to review. Hopefully they should be posted by the end of this week.
I see. Hi, Ian. Great. I just see a couple more comments coming in the questions. I don't know if you wanted to follow up on those or.
Let's see. Yeah, okay. Rachel, it is in blue. It's a minor procedure on the STS data collection form, not an IQVIA issue. Okay. I'm sorry, Rachel. I'm sorry, there's a lot of questions coming in regarding the decort. Rachel, if we could take that offline, if you could just email me, we could discuss that offline. I'm sorry, I'm unable to answer your question right now, but I would prefer to look at that offline and confer with Carol and others before I'm able to give a response, so I appreciate that.
We also have Dr. Wormuth on the line, Leanne. If there's anything you wanted to ask, if he's available, he may be able to provide some insight into the decortication.
Okay. Dr. Wormuth, are you available?
Yeah, I was talking on mute. It's always fun. No, so I think that might be a version 2.3, 2.41 difference. I was just trying to pull up the 2.3 DCF to see where the decortications fell in that. but we probably will have to answer it offline. But we have to pay attention to the versions for some of these procedures.
Right. Yeah, Mary had indicated decortications are not analyzed on the DCF, but analyzed in the harvest report.
Right, but if it was a 2.3 case, that might still be true. It wouldn't be true in 2.41.
Right.
Maybe this is one of the areas that we can take offline, but maybe this is also something for the next monthly webinar that we can talk about the difference between the 2.3 and 2.41 capture of decortications.
That's a great idea. Oh yeah, Mary says it is a difference. It became minor in 241. Okay, so, but again, like, well, we may have to just take this offline and we would get back to you. Let's see here. So our next question, so is the intent for temp coded field, so the intent for temp coded field is to collect this field on all patients from April 1 going forward, even if they did not have a test or if it was negative?
Correct. This is Carol. Yes,
Thank
that's
you,
correct.
Carol. Yep. All right. Thank you, Carol. Right. Oh, the decortications are one of the 9 specific procedures analyzed in the detailed section in the back of the harvest report. All right. But again, Mary, this is something that we'll look at, and I think we'll address offline. So we can take our time and look into your questions specifically and get a response for you. I do not see any other questions coming in. We are almost at 15 minutes after the hour. So I think we'll actually go ahead and wrap up for today. Again, we just wanted to thank everyone for attending today's webinar. We just have one last question come in that says, are we supposed to be capturing the COVID-19 questions effective 4/1? So yes, effective 4/1. If you're not required to go back to January 1 to collect data on those patients, but you can if you have sites that reported, you can go back to January 1 if your site was impacted, but we are looking for everyone to answer that question effective 4/1. But again, you can go back. All right. But again, we just wanted to thank everyone for joining today's webinar. We appreciate you again taking time out of your day. Our next scheduled webinar is on May the 13th at 1:30 Central Time. So we thank you everyone for joining. And as always, if you have any questions, please feel free to email me directly, ljones@sts.org, or feel free to give me a call. So thank you everyone for joining, and we hope you all stay safe and healthy, and thank you for all that you do. We hope you all have a nice week. Thank you.
Thanks, Leanne.